Hi, my name is Ritinder Kaur and I'm in class BSN 366 and I am recording and performing a central line dressing change um, per order, and I will be going into my patient's room. Hi John, um, I'm here to do your central line dressing change, and I will give my patient the privacy and the safety, and I will ask my patient for their date of birth and name and date of birth to verify, and the patient does state their name and date of birth and it is correct. And before I begin anything, I will instruct my patient to either look away, turn their face away, or I put on a mask, or I will put on my patient's mask. And to do that, I will perform a hand hygiene. And I will put a mask on myself first, and then I will put a mask on my patient, and then perform hand hygiene again. And I will put clean gloves on to remove the old dressing. And to remove the old dressing, we are going to anchor the dressing with non-dominant hand, and we are going to clamp the catheter at the distal end so it does not fall while we're doing the dressing change. And we're going to lift the dressing from all four sides, going up. And we are going to discard this dressing. And at this point, we are going to check for any infection at the skin around the catheter at the IV site, and we're going to check for any infection with the catheter, any dysfunction with the catheter. There is no swelling, no redness, no bleeding noted, no drainage noted, and with the catheter there is no any kink noted, no drainage noted. The catheter is intact, and the patient is complaining of no pain at the site at all at this point. And at this point, we are going to discard our clean gloves, and I'm going to prepare my sterile dressing tray, and we're going to perform hand hygiene. And this is my sterile dressing, and we are going to open my dressing tray. I'm going to open away, and I'm going to pinch and drop. Only at the 1-inch border. And we are going to apply the sterile gloves. And right now at this point, I will be keeping my hands above my waist at all times, will not drop them below my waist to keep the sterility. And with my dominant hand, I'm going to grab a chlorhexidine. And then with my non-dominant hand, we're grabbing some gauze, which is, we're just going to pinch it. And to activate the chlorhexidine, this has already been used, but you would hear a cracking or popping sound, and this will activate it. And then with my non-dominant hand, I will be picking up the catheter, and we're going to clean around the site for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. And then we're also going to clean underside of the catheter in case it drops at this point, so it is still clean. And we are going to clean the upper side of the catheter as well. At this point we can drop this and we are gonna discard our supplies. And at this point we will be changing the dressing. We're going to apply the Tegaderm. I do not have the Tegaderm, I've already used it. So we are going to pretend that this is a Tegaderm and this is just a big Band-Aid. And this right here, we are going to apply the dressing all around. We're going to press all 4 corners. And we are going to put our initials, date, and time. And we're gonna just put this on the side so it'll be easier. At this point, we are going to discard all of our supplies. And I'm going to remove my gloves. I'm going to perform hand hygiene, and I'm going to remove my mask and discard it. And I will remove my patient's mask as well and discard it. And at this point, I will be bringing my patient's bed down to safety and then giving him a call light. So if he needs any help, he can, the patient can ring the call bell. And I will be asking my patient if he needs anything else from me. And the patient states at this point they do not need anything from me. Thank you.